Very interesting. And then it's not, let's say that you excluded derangement, is not dysfunction, and then you go to others. So how do you manage this others classification?
It's depending on the subgroups of the other category. So if it's chronic pain, we definitely do a lot of education, patient education, pain education. If you see a chronic pain picture, widespreading pain, and linked to a lot of kinesiophobia, yellow flags, definitely you have to address a lot of the pain drivers. We do have sometimes MRIs. You may sometimes have to collaborate with doctor, schedule maybe injection if the pain really doesn't change. And the doctor I work with, they do a lot of pudendal nerve injection of or they block the sacral plexus. And with others, you just follow what already you use your 𝐏𝐸𝐥𝐤 training and you apply to your pelvic population. And sometimes you have to tell them, if this pain really is not worse, you have to start gradually to get back to your sexual function, sports activities. You really get back to their function quickly. You treat their pain and function at the same time. So they're I think similar to extremity other subgroups. We don't right now have a consensus on how to treat these groups. Even for the classification, I think we still have a little bit discussion. But I think with time, the more we see, because I think that still we don't understand these groups too very well, especially some of the mechanical inconclusive issues. We're not really clear about that. So I think that's with time, the more patient we see, probably the treatment will be, better. The result will be better. Yes.
Yeah, for sure. And do you see a lot of psychosocial too?
Definitely, that's really a lot of things.
I imagine.
Yeah. We do I think anxiety, depression is very common. We just did our study. I think we have certain amount of people that have anxiety, depression as a comorbidities. But not necessarily they have this before. Is when they have pain and they develop anxiety and depression as a secondary problem. And we do see a certain amount of people have sexual abuse history, a lot of relationship issues, sexuality issues, body images. It's more complicated than a regular elbow pain or shoulder pain. Definitely, there's more things to consider. Yeah.